When you think about innovation in healthcare, the next medical miracle may be the thing that comes to mind. But if you stop there, you'd be missing key opportunities. A large part of BD's portfolio is essential tools like needles, syringes, IV catheters that clinicians use to care for patients day in and day out. The potential impact of innovation in this space to improve outcomes and ease burdens is then magnified by the millions of patients and providers who rely on these critical care devices every day. IV insertion may seem like a simple, possibly unremarkable procedure. However, my firsthand experience tells me how pivotal and emotional the early stage in acute care journey can be for both patients and their clinicians. As a physician and specifically an interventional cardiac electrophysiologist, I have my own experience with needles. I've never lost sight of how needles are diagnostic and therapeutic instruments to be used with great care and only when the potential benefit to the patient exceeds any potential harm. Since that harm can take many forms, including pain, bleeding, risk of infection, everyone strives to breach the skin as few times as possible. And that's why I'm particularly passionate about the future of vascular access and the promise of reducing the number of sticks a patient will undergo during their hospital stay through what we call our one-stick hospital stay vision. Despite placement of peripheral IV catheters being a regular daily occurrence, perhaps too regular, problems are then all too common. Initial insertion success rates hover only around 70%. Up to half of these devices will fail unnecessarily, and then there are preventable complications. And nearly 2/3 of patients are considered difficult sticks and may need multiple attempts and support from other clinicians to place the IV. And even after you place that initial catheter successfully, it typically has not been ideal for all uses like blood draws, which patients encounter on average 2 times a day during a hospital stay. Today's experience with peripheral IVs is ripe for meaningful innovation. We see a clear path for better and more compassionate care. Imagine a future where a needle stick could be a single occurrence during a hospital stay. BD envisions a 3-pronged approach to optimizing IV access for both patients and providers. First, reducing the chances of a failed attempt at a needle stick using intuitive technologies like ultrasound and needle guidance. Second, advocating for a single access point for all required therapies and blood draws to eliminate the need for multiple access points. And third, ensuring clinical guidelines are in place that optimize the maintenance of an IV line and ultimately reduce the risk of infection. That's our one-stick hospital stay vision. Through continued innovation in this area, we can drive meaningful change for patient outcomes and elevate clinical practice while reinventing the 2 most frequent medical procedures that touch patients every day: blood draws and IV insertion.